For how long can you be contagious with the pink eye? Pink eye is an eye condition that is very common which causes red, itchy, and painful eyes. Viruses, allergies, or bacteria can lead to pink eye. Bacterial and viral pink eye are very contagious. Both the children and the adults that has pink eye should stay off from school, daycare, or work till the symptoms has gotten cleared. Each types of the pink eye has different times it get cleared up. Pink eye that is caused by a bacterium would take almost 24 to 48 hours before its symptoms begin to get improved as far as the affected person is taking antibiotics. The virus-caused pink eye would take about few days or a week before it gets resolved. Pink eye that is a result from an allergy would clear normally as the allergy symptoms begin to lessen. Different kinds of pink eye. Viral, bacterial, allergic are the major three pink eye types. The allergic pink eye, the common allergens which can cause a pink eye include 1. Grass. 2. Dust. 3. Animal dander. 4. Tree pollen. 5. Mold. 6. Ragweed. The pink eye isn't contagious if it was caused by an allergy. The viral pink eye. The viruses which are the cause of the pink eye include: adenovirus is the most common one by far. Herpes virus very dangerous and not common. People can also be infected by pink eye through infection that does spread from nose to the eyes. Also, it can get transmitted through the droplets of a sneeze or cough which lands on your eye directly. The viral pink eye also can stem out from cold or the upper respiratory infections. Depending on the infection severity, the viral pink eye could last for few days to 2 weeks at least. The bacterial pink eye. The causes of the bacterial pink eye that is very common which spreads from a person to another person include: having personal hygiene or some other items shares. Making use of old or unclean makeup that has bacteria in it. Making use of dirty hands to touch the eyes. A pink eye caused by bacteria infection can last for like 10 days when there is no treatment. However, when there is treatment it should resolve within few days. If the pink eye doesn't get improved with antibiotic drops quickly, it might be viral infection rather than the bacterial infection. 7 signs to know if a person is contagious. If there is still a symptom of a pink eye present, the affected person is still considered to be very contagious. This is very true in every cases in exception that the pink eye was allergy caused, which is common. Listed below are the 7 signs that the person is still very contagious. 1. Crusty lids and eyelashes. 2. Burning sensation. 3. Tearing up. 4. Inside the eyes it would either be pink or red. 5. Eyes getting irritated. 6. Having eyes discharge. 7. There would be swelling when you check the eyes. A school, workplace, or daycare would request often that the affected person shouldn't return till the symptom has cleared out. How pink eye can be getting rid of. The treatment for a pink eye would depend majorly on the infection severity and the type. Mild cases can be able to clear out on its own without any medical intervention in few days' time for either the bacterial or viral pink eye. The pink eye caused by allergy clears out often as the allergic reactions gets controlled. While the pink eye is healing, some people can make use of the following: hot or cold compresses for swelling to be reduced. Can make use of artificial tears for more moisture to be added and have symptoms eased. You can get this online. Making use of a cloth that is clean to have the eyes wiped. Making use of eye drops that has antihistamine. People should do also, disinfect and clean all eyewear. Throw away any contact lenses that is disposable. Have old makeup thrown out. Shouldn't make use of makeup until every of the infection is cleared out. While still infected, contact lens should be discontinued. A doctor should be consulted in cases that are more severe. The medication might include eye drops, that is antibiotic, in order to have the bacterial infection cleared out. Medications that is antiviral for the viral infection to be fought, like herpes. A doctor can also recommend additional treatments for the allergic reaction to be reduced in cases that the pink eye is caused by allergy. Questions and answers. The following questions listed below are the most frequently questions that are been asked about the pink eye. Will a pink eye disappears by itself? Yes, it might go away. It takes often few days to like 2 weeks if it's a mild infections. A person that always has a pink eye very often might have a discussion about it with their physician to know as there is underlying reason for it. When would it be safe to go back to school or work? Affected people shouldn't go back to school or work until the symptoms has cleared out completely. You can have a discussion with your doctor to know when it would be safe for you to return back to your normal activities. A guide to attain when you can return to school or work is the bacterial pink eye. You can return 24 hours after you have taken antibiotic treatment. The viral pink eye, you can return after 2 days to a week. The allergic pink eye, there isn't any need for you to stay at home. What should I do with the unused makeup? Any products and makeup that is used on the eyes or near it should get thrown off if it got applied just prior or during an infection. It's dirty and old. It's quite better to purchase new makeup products than risking the use of the tainted makeup which could make the infection spread. Should the contact lenses get thrown out? Most people won't want to have their contact lenses worn when they are affected with pink eye. Lenses that are disposable which was worn either during or right before an infection should get thrown out. The hard lenses would get cleaned very thoroughly because they are put to use again. Infections can also prevented by people by making use of contact solution that is sterile to have their contacts stored and have their hands cleaned before they remove or insert them. What would I do when my newborn is affected by a pink eye? Parents of a newborn should have the newborn baby taken to a clinic for a doctor to take a look at the infant. Watery discharge that is persistent might be because the tear duct is blocked, but the eyes won't be red usually. A tear duct is blocked would clear often by itself. In newborns' other cases, it might be an infection that is more serious which would require medical attention quickly. How can pink eye be prevented? It can be a bit tricky to avoid pink eye because it's highly contagious. Try much to avoid people that are affected with pink eye till they have their symptoms cleared out. Everybody can take these following precautions. Rub eyes or touching the eyes. Washing your hands very well, most especially when you are removing or inserting contacts. Personal items not shared. Making sure your glasses and contacts are cleaned thoroughly. Washing your towels, pillowcases, and clothes regularly. Stay put at home when you are infected. Takeaway. Though it's sometimes painful and common, the pink eye isn't majorly a concern often. People should try and avoid affected people until their symptoms has cleared out because it's very contagious, especially it is caused by an infection. People are very safe to resume back to school, daycare, or work once their symptoms has cleared. Treatments are required often only when the case is very severe, or when it's not clearing out on its own.